Pandemic influenza. Influenza A viruses have infected many different animals, including ducks, chickens, pigs, whales, horses, and seals. However, certain subtypes of influenza A virus are specific to certain species, except for birds, which are hosts to all known subtypes of influenza A. Subtypes that have caused widespread illness in people either in the past or currently are H3N2, H2N2, H1N1, and H1N2. H1N1 and H3N2 subtypes also have caused outbreaks in pigs, and H7N7 and H3N8 viruses have caused outbreaks in horses. Avian influenza A viruses may be transmitted from animals to humans in two main ways: directly from birds or from avian virus-contaminated environments to people, through an intermediate host such as a pig. Symptoms. People infected with the strands H5N1 and H1N1 have shown everything from typical human influenza-like symptoms, fever, cough, sore throat, and muscle aches, to pneumonia, severe respiratory diseases, and other life-threatening complications. Symptoms of influenza may depend on which specific virus subtype and strain caused the infection. Prevention. The best protection against pandemic influenza, a vaccine that is well matched to the virus causing illness, is not likely to be available at the outset of a pandemic. Community strategies that do not involve vaccines or medications, also called non-pharmaceutical interventions, may serve as a first line of defense to help delay or mitigate the spread of influenza. Treatment. Antiviral drugs could be used to treat individuals with influenza illness. However, prevention is the best strategy during a pandemic. Personal prevention strategies. Avoid close contact with people who are sick. When you are sick, keep your distance from others to protect them from getting sick too. Stay home when you are sick. If possible, stay home from work, school, and errands when you are sick. You will help prevent others from catching your illness. Cover your mouth and nose with a tissue when coughing or sneezing. It may prevent those around you from getting sick. Washing your hands often will help protect you from germs. Avoid touching your eyes, nose, or mouth. Germs are often spread when a person touches something that is contaminated with germs and then touches his or her eyes, nose, or mouth. Practice other good health habits. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and eat nutritious food. Mitigation guidelines issued by the CDC, April 2009, include social distancing strategies to reduce contact between people. Closing schools. Canceling public gatherings. Planning for liberal work-leave policies. Teleworking strategies. Voluntary isolation of cases. Voluntary quarantine of household contacts. Pandemic Flu Family Guide to Preparations. A flu pandemic is a global outbreak of influenza that occurs when a new flu virus appears, to which people have little or no immunity. Pandemic flu spreads easily from person to person and can cause serious illness because people do not have immunity to the new virus. Seasonal flu outbreaks are caused by viruses to which people have already been exposed. Flu shots are available to help prevent widespread illness, and effects on society are less severe. It is difficult to predict accurately when influenza pandemics will occur, how severe they will be, or how long they will last. A pandemic may come and go in waves, each of which can last for months at a time. Everyday life could be disrupted due to people in communities across the country becoming ill at the same time. These disruptions could include everything from school and business closings to interruption of basic services such as public transportation and health care. An especially severe influenza pandemic could lead to high levels of illness, death, social disruption, and economic loss. The effects of a pandemic can be lessened, however, if preparations are made ahead of time. As you plan, it is important to think about the challenges you might face, particularly if a pandemic is severe. It may take time to find the answers to these challenges. The following are some situations that could be caused by a severe pandemic and possible ways to address them. Social disruption may be widespread. Plan for the possibility that usual services may be disrupted. Such services could include those provided by hospitals and other healthcare facilities, banks, stores, restaurants, government offices, and post offices. Prepare backup plans in case public gatherings, such as volunteer meetings and worship services, are canceled. Consider how to care for people with special needs in case the services they rely on are not available. Being able to work may be difficult or impossible. Find out if you can work from home. Ask your employer how business will continue during a pandemic. Plan for the possible reduction or loss of income if you are unable to work or your place of employment is closed. Check with your employer about leave policies. Schools may be closed for an extended period of time. Help schools plan for pandemic influenza. Talk to the school nurse or health center staff. Talk to your teachers, administrators, and parent-teacher organizations. Plan home learning activities and exercises. Have materials such as books on hand. Plan recreational activities that your children can do at home. Consider child care needs. Transportation services may be disrupted. Think about how you can rely less on public transportation during a pandemic. For example, store food and other essential supplies so you make fewer trips to the store. Prepare backup plans for taking care of loved ones who are far away. Consider other ways to get to work, or, if you can, work at home. People will need advice and help at work and home. Think about what information the people in your workplace will need if you are a manager. This may include information about insurance, leave policies, working from home, possible loss of income, and when not to come to work if sick. Meet with your colleagues and make lists of things that you will need to know and what actions can be taken. Find volunteers who want to help people in need, such as elderly neighbors, single parents of small children, or people without the resources to get the medical help they will need. Identify other information resources in your community, such as mental health hotlines, public health hotlines, or electronic bulletin boards. Learn about the 211 phone system in your community. Find support systems. People who are thinking about the same issues you are thinking about. Share ideas. Create a family preparedness kit. Stay healthy. Take common sense steps to limit the spread of germs. Make good hygiene a habit. Wash hands frequently with soap and water. Cover your mouth and nose with a tissue when you cough or sneeze. Put used tissues in a waste basket. Cough or sneeze into your upper sleeve if you don't have a tissue. Don't touch your eyes, nose, or mouth. Clean your hands after coughing or sneezing. Use soap and water or an alcohol-based hand cleaner. Stay at home if you are sick. Routinely wipe down and disinfect surfaces with a solution of 1 part household bleach and 9 parts water. It is always a good idea to practice good health habits. Eat a balanced diet. Be sure to eat a variety of foods, including plenty of vegetables, fruits, and whole grain products. Include low-fat dairy products, lean meats, poultry, fish, and beans. Drink lots of water and go easy on salt, sugar, alcohol, and saturated fat. Exercise on a regular basis and get plenty of rest. Stop or reduce habits such as tobacco or alcohol use that could be detrimental to your health. If you do not have a primary care provider who is familiar with your health, find one. It may be difficult to find one during a pandemic flu outbreak. To learn more about the flu, the Centers for Disease Control and Prevention Public Response Hotline 800 CDC Info or 800 232 4636 English and Spanish 888 232 6348 TTY. Email inquiry@cdc.gov.